Okay. Happy Wednesday, everybody. This is Dr. Dan Yachter, the chiropractor, for our Wednesday segment news, views, and weekly updates. Every Wednesday, high noon, we bring you all the news that's fit to print, all of the most important, pertinent headlines on the healthcare landscape. We want to keep you guys tuned in and really just bring you the most important news releases and just information that's necessary to be in the know about to stay healthy, to keep you and your family healthy. We do this for our online community. We do this for our community locally. And we've got a lot of stuff to cover today. And I'm going to go ahead and jump in. And before I do, actually, I just wanted to mention we have coming up this upcoming Tuesday, my Achy Breaky Leaky Gut. That is a masterclass, 90 minutes at our office, 6:30 p.m. Our masterclass on gut health. And if you attend, it'll blow your mind on what you're going to learn about the second brain, the gut. You're also going to learn about how to test the gut properly, how to understand your gut in the most in-depth way, using the most advanced lab technology and reports that exist today. You want to be there. That's going to be in my office in Lake Mary on June 17th, 6:30 p.m. And we'd love to see you here. So I'm going to go ahead and jump in. And all of the articles that I'm going to be covering, all the topics, all of the mentions, everything can be found in our private group, our private Facebook group. All of these articles are posted. All of the numbers, the statistics, the data, it's all inside of my private Facebook group, My Family, My Mission. But we do this broadcast throughout our social media, our YouTube platforms. If you're on YouTube, you can go find us there. And we want you to join our groups so you can get this information, you can access it. But we're going to go ahead and start with the first post here from the Brownstone Institute. And the numbers, the statistics that I posted here are talking about the fatality rate of COVID. I cannot tell you how many people I've spoken to, and I see thousands and thousands and thousands of people. I interact with hundreds, sometimes per day, certainly per week, and probably tens of thousands of people per year. And in my interactions, it happens over and over and over again. Just yesterday, I had another another interaction conversation with a patient who's been with me 26 years, who got the COVID shots, who got 3 of them, and told me it is the worst decision that she's made ever, or at least in a long time. And she feels it's caused health problems. And what this Brownstone Institute report talks about is something that all people need to know, especially the ones who receive the COVID shot, is that the most endangered population or age range or age group were the people above 50, certainly above 60. So if you were over 60 during the previous 4 or 5 years, certainly between the years of 2020 and 2023, 24, you were told if you're over the age of 60, you better get the shot. You better get the COVID vaccine or you're going to be in big trouble. Your death rate is very, very high without the shot. Well, in fact, this Brownstone Institute report shows that certainly the vaccine was worse than the actual disease. In fact, the survival rate, the fatality rate and the survival rate listed here, I have this in my group, basically it was like a bad flu season, basically. That's what all the data. So now it's all in over the last 5 years, and that's been shown. And then that vaccine was basically worse than getting the actual virus by itself. And that's been proven. All the research is here. Next one that I have here, this is an important one. This is from an Italian study in an Italian province, a critical analysis of all-cause deaths during COVID-19 vaccination in an Italian province. Really, really important information. And what this publication shows, for those vaccinated with 2 doses, the loss of life expectancy in 739 days They looked at it basically 1.37 times that of the unvaccinated. This means that the subjects vaccinated with 2 doses of the COVID shot lost 37% of life expectancy compared to the unvaccinated population during the follow-up considered. We found all-cause death risks to be even greater, higher for those vaccinated with 1 and 2 doses compared to the unvaccinated, and that the booster doses were ineffective. We also found a slight but statistically significant loss of life expectancy for those vaccinated with 2 or 3 to 4 doses. Very important information to know. This is not my opinion. You should know if you're a pro-COVID shot person and you still believe that it was the right thing to do. All the research shows that it was not the right thing to do. In fact, not only did you lose life expectancy and you had a greater death risk getting vaccinated, but everything you told about the vaccines was a complete lie. That's all out now, that if you got the shot, your life would be protected, you wouldn't get infected, you wouldn't spread it to others. Your case severity would be less severe if you were infected. Your chances of going to the hospital or having to go to the hospital would decrease. Your odds of dying from the COVID virus would go down. Like, all of that was made up. And in fact, it was all lies, and not my opinion, but that's what all the research is showing now. Now that we have 5 years to look back on, showing it was a really bad idea. And this study, this Italian study, showing that not only was your loss of life expectancy 37%, you lost 37% of your life expectancy, but this data is coming in from all over the world, including our very own country. Here's another study, or another report that's come out from the Boston Globe, published in the Boston Globe. RFK Jr., he is the director of the Human Health Services and Services Department, basically, which houses the FDA, the NIH, all of the various health departments. So again, the Health and Human Services Secretary, RFK Jr., intends to shift the way vaccines are tested. He will order placebo testing for new vaccines. And that's alarming health experts because they've never had placebo testing. Basically, when they test vaccines, new vaccines against other vaccines, which is it's not true vaccine testing or an accurate way to test vaccines. All new vaccines will undergo safety testing in placebo-controlled trials prior to licensure, a radical departure from past practices. The Health and Human Services Secretary is now going to require placebo-controlled trials for new vaccines. Many vaccines, this article published April 30th, 2025, says many vaccines licensed in the US were tested against other vaccines rather than a placebo. And that's a problem because pretty much, all drugs are tested against a placebo, except vaccines, which is a big problem because you can't really get an accurate understanding of the potential damage that the vaccine can do or the symptomatology that vaccine can produce. Except for the COVID vaccine, none of the vaccines on the CDC's childhood recommended schedule were tested against inert placebos, meaning we know very little about the actual risk profiles of these products. So this is a good thing. Here's another thing that I published inside of our private group. This is from Focal points, April 15th, 2025. Study finds COVID-19 mRNA booster shots decrease pancreatic cancer survival by 50%. I'll go ahead and read that one more time. That bears a repeat. Study finds COVID-19 mRNA booster shots decrease pancreatic cancer survival by 50%. In a cohort of 272 pancreatic cancer patients receiving 3 or more mRNA doses increased overall death risk by 300% and caused a lot of other scenarios, including lowering your pancreatic cancer survival rate. And I have all the data in here. I have graphs, which you can see if you join our private group, My Family, My Mission. Your survival probability takes a radical nosedive in regards to pancreatic cancer when you get the shot, or if you got the shot. And so I got a lot of good, important information in there, but I just wanted to kind of give you the gist of it. That's not a good thing, just in case you're wondering. World Health Organization published data, brand new. You'll see this again if you are in the private group. The White House has published this on their website. This is an official document, an official declaration in regards to social distancing. The White House stance on social distancing, mask mandates, lockdowns, the New York pandemic failures, and the World Health Organization. And I'm going to read this to you because it's that important. The World Health Organization, the WHO, or the WHO's response to the COVID-19 pandemic was an abject failure because it caved to pressure from the Chinese Communist Party and placed China's political interest ahead of its international duties. Further, the World Health Organization's newest effort to solve the problems exacerbated by the COVID-19 pandemic by way of pandemic treaty may harm the U.S. Social distancing, again, all the information's here. The White House official policy and stance, social distancing, the 6 feet apart social distancing recommendation published on the White House website, which shut down schools and small businesses across the country, was arbitrary. So the social distancing thing was arbitrary, not based on science. During closed door testimony, Dr. Fauci testified that the guidance sort of just appeared. Social distancing, 6 feet apart. It was made up. Even Dr. Fauci, he testified based on that. Mask mandates. There's no conclusive evidence that the mask effectively protected Americans from COVID-19. In fact, the COVID-19 virus, small enough to go right through masks, public health officials flip-flopped on the efficacy of masks without providing American scientific data, causing a massive uptick in public distrust. The other thing that we want to know about is when you're wearing a mask all day, you're breathing toxicity back in. One of the ways that you get rid of toxicity, well, you can get rid of it through sweating, through the skin, the largest organ in the body, the largest detoxification organ in the body. You know, you can pee it out, poop it out, breathe it out, sweat it out. So breathing is one of the avenues, one of the channels you get toxicity out of. You're wearing a mask all day, you're auto-intoxicating, you're re-intoxicating, you're bringing it right back in. So you're making your body sicker, you're making your body worse, unless you're like hacking and coughing and blowing phlegm everywhere. You know, I think maybe the people around you probably appreciate you wearing a mask, but to do it to protect yourself or others, some viruses shown not effective because the virus goes right through the mask, in particular in pertaining to the COVID virus. Not only that, But when you do this, you weaken your immune system. It is proven scientifically, walking around with a mask all day. These are not my opinions. These are published scientific statements. This is the White House website. Prolonged lockdowns cause immeasurable harm to not only the American economy, but also to the mental and physical health of Americans, with a particularly negative effect on younger citizens. Rather than prioritizing the protection of the most vulnerable populations, the elderly, newborns, federal and state government policies forced millions of Americans to forego crucial elements of a healthy and financial sound life. We know that it was just a horrible failure in policy, and just a horrible 2 or 3 years in regards to the impact it had on our country. It was just, all these policies just really had a devastating effect, not only on our mental and physical well-being, but our country as a whole. The New York pandemic failures, former New York Governor Andrew Cuomo, March 25th order, which forced nursing homes to accept COVID-19 positive patients, was medical malpractice. Evidence shows that Mr. Cuomo and his administration worked to cover up the tragic aftermath of their policy decisions in an apparent effort to shield themselves from accountability. So I think this is an important thing to report on. I think everybody needs to know about this in preparation for the next time they try to pull the wool over our eyes, especially with telling us that these shots are good. Get and put them in your body. We warp speeded them onto the market, but don't worry, trust us, trust the science that we made up, which is all make-believe stuff, that it's going to protect you. It's going to keep you from spreading the virus. It's going to keep you at the hospital. It's going to make your case less severe. It's going to keep you from dying. Get it. Make sure you get it. It's 100% effective. All of it was made up. And now we know that it's true. It was all made up. So here's another one about JFK telling medical schools to teach, RFK Jr. telling medical schools to teach nutrition or lose funding. And this was published last week. And Health Secretary RFK Jr. said he plans to tell American medical schools they must offer nutrition courses to students or risk losing federal funding from the Department of Health and Human Services. This is a good thing. Now, a lot of medical schools kick back at that, saying, hold on a second, we already teach nutrition. We have nutrition in our schools, but they are few and far between. There are some medical schools that have it. But the problem is that there's no standard nutrition curricula. They're typically taught as an elective. They're optional. And not only that, but the pharmaceutical companies really, for the most part, and just your general medical teaching, your standard of care, really pushes any nutritional training out of the way, and it focuses on prescriptive therapeutic approaches, not nutritional approaches. I don't think I really have ever had a patient come back to me from their medical doctor and say, hey, you know what? My medical doctor told me, let's try this dietary change, this lifestyle change, this nutritional supplement prior to going on the medication. They want to see how this goes first, and then maybe we'll go to the drug option. They talked to me about probiotics, having more probiotic-based foods in my diet, taking this 10 billion CFU colony forming unit probiotic first, and then maybe move on to the drug intervention. Never ever heard that conversation repeated to me, but many of the medical schools are talking about, yeah, we have it, but it's not really organized, or it's not really a primary part of the curriculum. And so now there's talk about really standardizing the nutritional education in the schools broadly throughout the curriculum. And so this is a good thing. It's a good conversation to have. And, federal funding withholding is a good place to start, because it's a wake up call. And, whether he would follow through with that threat or not, RFK, I think it's kind of at least stirred up the conversation, and, got medical schools listening and understanding how important this is. Here's a really brilliant article here. Cranberry extract quickly improves the microbiome, and reduces cardiometabolic risk, reduces your heart attack, stroke risk. Great article. And we know that cranberry in particular feeds one probiotic strain in particular known as Akkermansia municiphilia. That actually is a probiotic in the gut, primarily the colon. When we talk about probiotics, that's where really you house most of your probiotics. But Akkermansia is very involved with governing, controlling inflammatory levels in the body, and also is involved with the mucus production that guards and protects the GI lining, the membrane. And cranberry feeds, it's a prebiotic that feeds the probiotics, keeps the commensal bacteria, the indigenous bacteria, the bacteria that should be there, keeps them well fed, in particular the Akkermansia. So that's what the article talks about. Obviously, that's going to help keep inflammation lower. It's going to keep the mucus lining of the stomach healthy. It also helps in the production of, cranberry feeds probiotics, the good bacteria in the gut, and that allows the good bacteria to produce. In fact, by the way, prebiotic, another good prebiotic is, any kind of fiber-rich food feeds the probiotics, which allows the probiotics to produce things like butyrates and propionates, which are the fuel for the enterocytes. The enterocytes are the gut cells, and those gut cells need fuel to run, to do all the gut functions, for motility, to move waste through the colon. And so again, the butyrates, the propionates, and these different things that are produced when you feed the probiotics good things like cranberry, it allows the gut to work normally. So this is a great article. Fiber-rich foods, cranberry. You also have a lot of great prebiotic fiber-rich foods and fruits and vegetables, whole grains, nuts, seeds, olive oil, fatty fish. Another great list here that I'm going to rattle off real fast of prebiotic foods: apricots, however you want to pronounce it, bamboo shoots, black beans, black tea, broccoli, cabbage, chickpeas, dark chocolate, kimchi, kiwi fruit, mango is a phenomenal one, peaches, sauerkraut, shiitake mushroom, sourdough bread, walnuts, and yogurt. Exercise also enhances microbial diversity. So great article here. And I posted it inside of our group, My Family, My Mission, inside of Facebook groups. Join, where you can actually get the full article. And of course, all the other information I was talking about. You have all the charts, the data, the reference sources. It's all there. So more cranberry. Cranberry is great. You can buy the whole seeds, buy the whole fruit, chop it up. You can throw it into a shake. Cranberry is just absolutely phenomenal, not just for the microbiota, for the gut bacteria, but it's great for the cardiovascular system, and it's an anti-inflammatory fruit, pomegranate. Fantastic. Juice or whole fruit or whole seed. Very good for your health. Moving on. RFK. And a lot of you guys saw this post actually yesterday. I posted this in the group, and this article. I'm going to scroll back to it. This is RFK. This is talking about RFK Jr. firing all 17 members of the Center for Disease Control's Vaccine Advisory Board. He did that citing their conflicts of interest in shaping vaccine policy. All 17 of them have direct ties to the pharmaceutical companies, in particular the vaccine makers. He calls the action a total overhaul to rebuild trust in vaccine science. Today, we are prioritizing the restoration of public trust above any specific pro or anti-vaccine agenda, Kennedy said. The public must know that unbiased science, evaluated through a transparent process and insulated from conflicts of interest, guides the recommendation of our health agencies. This is a groundbreaking win for health and to protect all of the families of our communities. So I think this is a great development. It's a great thing. And then, of course, we have the last posted article. Trying to scroll up to it here. For some reason, the scrolling is going very slowly. But one of the things you should know, whether you have a young family you're vaccinating, maybe you're still getting the childhood vaccines, I don't know, but this is a great resource. Dr. Paul Thomas, pediatrician, has written a couple of books, The Facts Want to Consider Before Vaccinating at All Ages and All Stages of Life. The 6-month well baby visit is the most dangerous doctor visit babies ever encounter. They are scheduled to get 10 different vaccines at once. Were you aware of that? 10 different vaccines at once at your 6-month well baby visit. Hep B, DTaP, IPV, Hib, pneumococcal, rotavirus, flu, and the COVID shot, which has, as of last week, been taken off the childhood vaccine schedule. Thank God. The autism prevalence has increased 384% since 2000. In 2000, it was 1 in 150. In 1970, it was 1 in 10,000. It is now 1 in 31. California, it's 1 in 12. And you will see the charts that I posted here showing, out of his practice, tens of thousands of children, vaccinated versus unvaccinated, right from his book, every health condition, every childhood health condition that you can name, including asthma, allergies, ear infections, colic, the list goes on and on and on. You name it. Eye disorders, eczema, ulceritis, diverticulitis, dermatitis, eye disorders, ear pain, infections, respiratory infections, ADHD, allergic rhinitis, breathing issues, behavioral issues. I mentioned asthma already. All of these things radically higher in the vaccinated, childhood vaccinated populations. Not my opinion. This is established medical science, facts, truth. Of course, the Medical Association of Oregon went after this medical doctor, this pediatrician, took his license away. But what the data shows, the risk of death from the disease versus the vaccine, you want to get this chart. You want to get your hands on this chart. In fact, I'm going to try to publish it outside of my private group so you can see it in my personal profile where we're showing this right now. But your risk of dying from a child or your baby, your child's baby, not my information, this is published data, your risk of dying from a childhood disease, polio, diphtheria, tetanus, pertussis, measles, mumps, rubella, varicella, hepatitis A, B, Hib, pneumococcal, meningococcal, and influenza. The flu, your risk of dying from these diseases is much lower than your risk of dying from the vaccine. Your risk of dying from the disease is much lower than your risk from dying from the vaccine, the childhood vaccine you're getting to prevent death from that disease. Absolutely crazy. And again, if you want to see this chart, you want the science and information, it's in my private group. You can take a look at it. Your risk of dying is far greater than your risk of dying from the disease, your risk of dying from the vaccine. Absolutely crazy. You want to see this information. So it's all there for you. Risk of death from the disease much lower than from the vaccine itself. How could that possibly be? And the other question is, do you think more parents in this community need to see and understand this information? So again, not my opinion. What I present to you is facts, and these facts can be checked. They can be looked up, they can be researched, and you will see that all of it is substantiated. I bring you all this news, views, and weekly updates each week. I bring it to you, not for my agenda, but simply to bring you information that may not be on your radar and is certainly a matter of life and death. And it's designed to protect you and your families. So you guys can understand that at least you have, with that understanding, informed consent, informed decisions. When you go to make decisions about your health and well-being, your family, your spouse, your children, that at least you have the knowledge first, and then make decisions that are informed. You make decisions that you have peace about. And that's really what these segments are about. Patients who I care for know that I don't have a dictatorial relationship with my patients. Do what I tell you to do, or else. I am an educator. I arm and equip my patients with knowledge, with information that they can take and they can research and fact check and give them a perspective that may be different than the one they currently have. And when they go to make crucial health decisions, life and death decisions, they have the knowledge they need to make the best decision and choice they can make. So again, as I leave you with this segment and this information, again, mark your calendars. June 17th, that's this Tuesday coming up, 6:30 p.m. at my office in Lake Mary. So in case you know where that is, that's North Orlando. My Achy Breaky Leaky Gut, 6:30 p.m. right here in the office, all about GI health. Been teaching this masterclass for almost 30 years. And we're going to arm and equip you with powerful knowledge. If you're a current patient, please bring a guest or guests with you, family members, loved ones. This is a life-transforming masterclass. Everybody have a great Wednesday. Thank you so much for joining me. Dr. Dan Yachter signing off. God bless.